A report has been published finding that a culture of bullying at one of England's biggest NHS trusts could put patients' care at risk. It's all part of an inquiry into serious bullying allegations at University Hospital's Birmingham NHS Trust, following claims that junior doctors were threatened if they raised safety concerns. Well, the lead reviewer of the report said he was disturbed by the consistent reporting of bullying at the NHS Trust. The report said that any continuance of a staff culture that corrosively affects morale will put patient care at risk. The report also said that the Trust is very reluctant to accept criticism, and it makes 17 recommendations for improvement across clinical safety, governance and leadership, staff welfare and culture. Our correspondent Becky Johnson joins us from Birmingham. This is a damning report, Becky.
This is a damning report into University Hospitals Birmingham, one of the biggest providers of healthcare, not just in England, but in Europe, employing more than 22,000 people. The report has found a long-standing bullying and toxic environment within this NHS Trust. It's revealed extensive complaints have been made by staff about the organisation's conduct, many concerned about a toxic atmosphere and bullying at all levels of management. It said the report team has heard many examples on a range of topics, including issues over promotion, bullying of staff, including junior doctors, and a fear of retribution if concerns were raised. Indeed, one survey found only just over half of staff at this trust felt safe to raise concerns with managers. Now, concerningly for patients, the report has highlighted a higher than would be expected mortality rate. In other words, more patients dying at this trust than would be expected. And the report says more investigation needs to be done to understand why that is happening. But the report says if the cultural environment at UHB has not already affected mortality, it is likely to be affecting the patient experience and morbidity. Effective team working leads to higher levels of innovation, and a culture of openness has been shown to reduce mortality. Lower recruitment levels, both medical and nursing, are associated with increased mortality and worse patient outcome. And if the staff's current concerns about the working environment have not already translated to less good treatment and outcome, every shred of evidence suggests they will do in time. So a damning assessment suggesting that the report's authors believe that the culture, the way staff are treated here, is now affecting patient care at this West Midlands Trust. Now, it found that as of November last year, over 13% of nursing posts at the Trust were unfilled. That's higher than the England average of 10%, and suggests that problems with recruitment are because of the culture at the Trust. It also detailed the very tragic events around the death by suicide of a junior doctor, Dr Vaish Kumar, last summer. Dr Kumar was 35 years old. She was working here at the Queen Elizabeth Hospital in Birmingham. She took a lethal overdose, and we've spoken to her parents, who say that she left a note to them saying that she did what she did because of what was going on at work. They say that she had become very tearful from being a bubbly, fun-loving woman. She'd become very tearful after working here, had spoken about bullying, had spoken about being belittled and laughed at work, and they'd seen her spiral into depression. Now, the report says that the way the hospital management dealt with Dr Kumar's death left many junior doctors very angry. They say that there wasn't senior management representation at her funeral. In fact, the Trust didn't contact her family until 2 months after her death. Shockingly, 26 days after her death, a member of senior management at the hospital who didn't know she died emailed her personally to ask why she'd been removed from her post and if she was still being paid. And the report found that her death wasn't the only death by suicide of a member of staff at this trust. Now, we've been speaking to Dr Kumar's father, who is also a doctor who works for the NHS, and this is what he had to say about the improvements needed at this trust.
Our life stopped on 22nd of June. And it's very hard to, each day is a struggle. Now, my main worry is to stop it happening to others. And that is why I want to bring this forward, so that people realize that there is a toxic atmosphere.
Now, I have just received a statement in response to this report. This is from the Chief Executive of University Hospitals Birmingham, Jonathan Brotherton. Now, he says patients can continue to be confident that the care and treatment provided at our hospitals is safe. We are pleased that Professor Buick's overall view, that's the report author, is that the Trust is a safe place to receive care. He goes on to say, we fully accept his recommendations and welcome the additional assurance that has been asked for through further independent oversight. There are a number of significant concerns that we need to and have started to address. We will continue to learn from the past as we move forward. The statement goes on to say, we want to develop a positive, inclusive work environment where people want to come to work in a place that they're proud to work in, to do their very best for our patients. While we will not be able to fix things as quickly as I would, we do need to do it as quickly as possible for the benefit of patients and staff. He goes on to say, I am committed to ensuring this happens. He says we must now focus on continuing to provide the best possible patient care, building a values-led culture and supporting our incredible colleagues. So that's the response from the Chief Executive of this Trust after the review found a culture of bullying could now be affecting patient safety.